Henry Ford Health, one of the nation's leading integrated health systems providing innovative, quality care for more than 100 years, and Michigan State University, one of the world's leading research universities focused on advancing the common good for more than 160 years, have joined forces to transform healthcare. The joint venture is a catalyst for change and reimagines how we think about, innovate, and deliver health and wellness. The goal is to set a new standard for how individuals and communities experience care across the state of Michigan and the nation. The landmark 30-year partnership is among the first of its kind for the region between a fully integrated academic health system and major state research university. It's focused on vital pillars of healthcare, research, education, and care, and initiating programs in crucial areas affecting health and wellness, including health equity, cancer, population health, and neuroscience. The partnership was announced in January of 2021. At that time, I spoke about the collaboration with Dr. Norman J. Beauchamp Jr., MSU Executive Vice President for Health Sciences, and Adnan Munkara, MD, Executive Vice President and Chief Clinical Officer for Henry Ford Health System. Those two gentlemen join me again today for a progress report. How's it going? I mean, remind us what some of the partnership's key goals were. I mentioned a few, and sort of give us a progress report. What are some of the partnership's achievements and milestones?
I can get started, Russ. I think things are doing extremely well. It really has been such a pleasure to be working with our partners at Michigan State University, and all the things that we have set ourselves as our goals to make happen are working very well. Most importantly, the excitement that we are seeing among our teams on both sides to deliver on our vision, which is really to be transformational partnership in health and healthcare across our region and in the nation, is resonating extremely well. It is building on the values that we have independently and now in this partnership. And we are seeing that people are really committed to what we want to do together. And we can go during this podcast to talk a little bit more about some of the specific achievements. But from how I'm assessing it and where we are going, extremely excited. I think we've made extremely great advancement and progress on all the things, on all the fronts that we have set ourselves to do. And there are many other things that we are starting to start discussing.
You know, Adnan characterizes it really well. Is, you know, we had a hope when we started that, done correctly, individuals, students, staff, faculty would feel more enabled, more empowered to accomplish the mission that brought them to our respective organizations. And that has perhaps been the most delightful part, is that as we've brought people together, they see it, right? They're experiencing it, this ability that together we can do more to bring health, hope, and healing to all people. And we laid out an aggressive set of goals because of a sense of urgency that people deserve and need better. And the charge has just been taken up and gone at. And I would recognize that this is in the setting of a pandemic, that people are carving out time to do this work because it's so important. And again, look forward to talking through some specifics, but maybe just one very pragmatic was that as we've tried to navigate the pandemic together, from the MSU perspective, having a partner like Henry Ford with its scope and scale of practice has been very helpful, for example, in things like the assessment of our athletes when they've had COVID, to make sure that there wasn't the presence of myocarditis, as an example. So it's really helped us navigate the pandemic in addition to pursuing all of the goals that we've laid out.
So what are some of the specific sort of achievements and accomplishments you'd like to highlight?
Henry Ford is unique in its commitment to research amongst large health delivery systems. And one of the things that we sought to do is to bring our researchers together. So we now have been able to welcome 115 researchers from the Henry Ford Health System into Michigan State to foster this collaboration, both connecting our basic science researchers as well as connecting our basic science through to the clinical delivery and the education arm. I think that was one area that we're really excited about.
I would add also to the research component that Norm has mentioned is one of the things that we've asked our team, and they've been wonderful at delivering to, is to say, in order for people to feel that they are together, they need to view the home that they are sitting in with respect to research as one home. It cannot be two different places, two different areas. So, and I'm talking about home, not really the brick and mortar, but I'm talking about this infrastructure as well as the organization that houses these researchers. So in addition to what Norm has said, his team have done an amazing job facilitating these researchers being welcome as faculty at Michigan State University. The teams have started to work at creating very innovative as well as out-of-the-box ways for us to pull our federal funding together so that, one, it is accounted for the right way, but also to level down barriers and hurdles. If when we are getting two researchers together from different institutions, what institution name goes on that? How do we handle that? People now, we wanted to make sure that people are not having more hurdles to kind of apply for funds and grants, but to collaborate together and they feel that they are pulling and pushing for the good of both. And I think the team has created structure, and they've been in discussion with the NIH of being able to have that migration of federal funding. So it is housed within a place within MSU that has the Henry Ford Health and MSU kind of name and branding on it, and people will feel welcome from both sides.
Yeah, and maybe then giving us a specific example to the listeners would be helpful, Russ, where one of the combined goals that we have is to address cancer outcomes for the state and really address the fact that at present, where you're born and where you live can determine your outcomes in cancer, and it's not acceptable. And we've come together saying with MSU's rural reach and Henry Ford's, strength in delivering excellence in cancer care in an urban setting, right? And can we connect those strengths? An example would be that the incidence of cancer in rural Michigan is higher than in the urban parts of the state, but the death rate is higher. And we see that in bringing together this will improve both urban and rural outcomes. And we want to seek something that's referred to as NCI designation, which is really a way to be recognized nationally, which in turn allows us to bring more clinical trials. It allows us to recruit and retain. And as a part of applying, you have to show your strength as an institution. And what we were able to do is in doing this accounting, see that we have over 100 scientists and clinicians across both institutions that are doing really important work in cancer, and that in fact combined we're already generating about $8 million in active funding across the institutions. And Adnan and I and colleagues brought both institutions together for a symposium in August. And it was just really powerful to see the researchers, the clinicians, the administrators come together. And by really recognizing how far along we already are, it was really energizing to say, you know what, we're going to get this NCI cancer designation done, and it's going to bring great benefit to the people of Michigan. We were really excited about that. And just adding that Adnan and I have the privilege of speaking to you today, but there is a legion of dedicated people that are doing this work. And this was an incredible example of that.
Russ, to the point that Norm has made, to put it in perspective, that $8 million in federal funding, yearly federal funding for cancer research, takes us about almost more than 3/4 of the way with respect to the funding within that journey toward NCI comprehensive cancer designation. Now, we understand there are a lot of other foundational things that we continue to bring together. We believe that these foundational things exist. We just need to bring them together. It is like when you have certain material as you're building a big house, and you have the material, you just need to place it in the right place to be able to kind of do what you need to do and build this great castle, great mansion that is people are going to be proud of. And we really believe we are there because we have the people, the excitement among these people who are coming together, and as part of that encouragement. Dr. Ben Mofsas from Henry Ford Health System, Norm Hubbard have been co-chairing that cancer committee within the Health Science Center. And in addition to bringing people together, they've put also certain competitive programs out there asking people to say, if you can identify projects where the teams can partner from both sides, we can give you some small seed funding. And they've got so far more than 60 proposals within a matter of a couple of weeks to kind of people excited to work together on ideas that are going to advance the cause of innovating, improving the treatment of cancer, get closer to a cure, prevention and cure. And as Norm has said, leveling down and eliminating health disparities in outcomes, disparities in cancer outcomes. So a lot of work has been done within, if you think about it, we started at the end of January in 2021, in the midst of a pandemic, 2 big surges now, and the teams are working so well together with very tangible deliverables.
This is MSU Today. I'm talking with MSU's Dr. Norman Beauchamp and Henry Ford's Dr. Adnan Munkara about the collaboration between these two well-known brands in Michigan. And Norm, you touched on the importance of some of the access with our rural strength and Henry Ford's urban strength. Say a little bit more about the importance of access and the importance of diversity, equity, inclusion, and justice in the collaboration.
We hold deeply, and you can see it in the strategic plans of both organizations, that all people deserve access to equitable, affordable, safe care. And there's an aphorism that's very meaningful. The great Dr. Martin Luther King Jr., who said that of all forms of inequality, injustice in health is the most shocking and inhuman. And he uses the term inhuman because it truly is something that's a call to action. And as we looked at this, we said, now more than ever, we can go directly at this challenge. And the way that we've brought this together is that we have these areas of focus: education, research, clinical care, cancer in specific. And we created a kind of almost an oversight committee or a guidance committee that is purely dedicated to thinking across these dimensions. What are the opportunities and the needs based on our commitment to diversity, equity, inclusion, and justice? The committee is equally represented by members from Henry Ford and MSU. And what they have is they have representatives that sit on all of the committees that we're driving to just make sure that front and center, are these considerations and that we're being intentional. And the way that, Adnan and I have seen this manifest then is to say, what can we do better in giving students of all backgrounds access to careers in health, both nursing and medicine? And it's led to this expansion of training slots in Southeast Michigan across both of the colleges of medicine, as well as the College of Nursing. And in so being, we will create opportunities for students, and we believe really greatly enhance the commitment to having providers that can meet needs of all the people we serve in education. When it comes to research, an example of this, and Dr. Munkar has been a leader in thinking about access to cancer clinical trials. And what you see is that you see communities of color, for example, not have equivalent access or participation in clinical trials, which has two really detrimental effects. One is that as you discover new ways to treat cancer, they may not be as effective in the underrepresented communities that weren't allowed to participate or weren't engaged in participating. But second, clinical trials are also a source of hope. When all of the common treatments for cancer, the existing treatments for cancer have not been effective, and individuals through clinical trials can access the most recent, the most advanced ways to treat cancer. And so Henry Ford has really established themselves as a leader in clinical trials across communities, and are connecting together. We believe we can enhance that.
So building on what Norm has touched on, as we look at it first from equity, all of us agree that it is really shameful that in one of the, if not the most powerful and the most developed nation in the world, it is among the top one or two most powerful and developed nation in the world, that we still have issues with access and equity in care, where we have significant health disparities. And first, recognizing this is extremely important, is the first step in that journey. The second one is trying to find solutions. And part of the solution, as Norm has talked about, is to make sure that the most advanced and the best healthcare is available to every single member of the communities that we serve and beyond. And in order for us to do that, when we add our resources with the Michigan State University resources, we are always believers that 1 and 1 goes beyond 2. It goes beyond 3 and 4. 1 and 1 might make 5 and 6, equal 5 and 6 in those situations, because we really think that it is that incremental value that we add by being present by adding our resources together and also our knowledge together. The work that they have done in Flint during the Flint water crisis is amazing. It's a great example of how we can address a public health issue. Things that we are working and doing on social determinants of health now in our vulnerable populations in Southeast Michigan. These are things in my mind that are very applicable in rural areas as we identify the venue and the structure to do that going forward in that respect. I think clinical trials, as Norm has mentioned, are going to be extremely important. Building a trust in clinical trial, not only making them accessible, but building trust in that. In order to do that also, we understand that we need to change the way we think, and we need to change I don't want to say the culture, because I think we have great cultures and values, but the composition of what we have at the present time. We need to be more inclusive, have a more diverse group of providers, of leaders, women leaders, leaders of color, people with different backgrounds that are able to connect with communities that we serve, that the communities trust. And in order to do that, we need to be able to recruit, retain, matriculate and retain medical students as well as nursing students that continue to serve the communities that we are in. And the work that Norm and his team, and we are doing here at Haniford Health System, is extremely focused on that. How do we make sure that we have the brightest people want to come to this partnership so that they get their medical education with Michigan State University, they get their training with our healthcare system, and then they stay with us to be the future physicians and nurses and providers and healthcare workers that provide the services within our communities. So I really think we have a clear plan where we want to go. We are very excited about it because we don't think it is a pie in the sky. We really think that it is achievable. We think we have the, as we said, we have the dedication, determination to make it happen. And we are excited about what we have seen so far from our teams.
The other thing that we're excited about is that when MSU completed its strategic plan, it developed the health sustainability pillar. And within that, it talked about not just connecting the health colleges to the partnership with Henry Ford Health System, but recognizing the incredible strengths that exist across the campus in improving health. And that part of the next step in the strategic plan and discussions Adnan and I have had is how then do we connect these strengths? And we've already had very compelling conversations with individuals in social sciences, in communication arts, in engineering, and in supply chain. And we see that a key part of addressing these disparities comes from engaging the entire MSU campus in really a comprehensive approach to improving health, where we can, leverage our expertise in elevating activities in care, education, and research. So that's also a really exciting part is now the momentum starting to build. And over the next 6 months, really working with the deans and the faculty to find all of these cross connections. And we feel like year one of this relationship has advanced the delineation of the why and some of the tools to facilitate connections.
And gentlemen, as we enter the second year, then what are some next steps? What are some things you're looking forward to that you want to clue us in on?
So Russ, I'll talk about a couple of things that come to mind. The first thing, and again, building on that concept of health disparity, collaboration, both on research, education, but also impacting the health of our community. A healthy community is built on its youth. In order to have a healthy youth, you need to have healthy mothers. You need to have mothers who are healthy both mentally as well as physically. We need to have healthy infant and healthy children. So some of our work that we are starting to put together, and this has been really made possible by the fact that Norm and his team allowed us to partner with one of their great leaders in women's health, Dr. Rick Leach, whom we recruited now, who is our chair of women's health at Henry Ford and the chair of OBGYN at Michigan State University, putting a plan for us together to address the issue of maternal health, maternal mortality, and infant mortality in our most vulnerable populations. So this is going to be some of the work that team is going to be tasked and empowered to address over the next few years. Another thing that we are starting to talk about is how do we bring together our clinical strength so that we have a seamless coordination and delivery of care across the markets that we are in and across the geographies we are in. We sit in Southeast Michigan and Central Michigan. Michigan State University clinical services sit in Lansing, but they have a much wider outreach that Norm can speak to because they have great alumni groups all around the state. And the question, how do we kind of build on this huge network, which is a great start for us to implement and spread the clinical excellence and the excellence in healthcare that we provide across the region, and how do we create, like we've done in research and education, collaboration in clinical services, because we need to connect all of these dots together to get us where we want to get to.
A nice example of building on what Dr. Munkar said, and I should add, Russ, that Dr. Munkar is actually a leader in women's health research. He's very humble. And part of what we have talked about is that in coming together, we increase our strengths. And one of the approaches was this aligning leadership and departments. And we saw women's health as such an important way to really improve so many aspects of health. And so by having Dr. Leach now in this bridging role across both of our institutions, the current projection, as I think of June of 2022, is we'll have the #1 department of obstetrics and gynecology in the nation, the highest funded. Now that's all the indicators. And I think that is a remarkable statement of how, in combining our leadership and our strengths, we're positioned to do more. So that's one thing I'm excited to see come forward. And I think it will be catalytic as we think about other ways we'll connect our academic departments. One. Second is we have we made a commitment to increase the nursing training slots and opportunities by about 100 and 50 for each of the medical schools. And we will be now starting to matriculate students already in 2022, which again, we're really, really excited about. And then maybe the third is that as we think about improving health, both of our organizations have incredible divisions of public health, and prevention is such a key part of helping the populations, being able to provide care in an affordable way. And one key part is both the delivery of care, but also kind of an insurance product, right? And MSU didn't have the scope and scale to be able to put together a partnership that included an insurance product offering. But it's such a key part as we think about value. And because of our partnership with Henry Ford, we've now been able to come forward with the Health Alliance Plan and MSU Healthcare to create a Medicare eligible program for MSU alumni. And so that's a way to bring value to the people that have graduated from MSU, our alumni, other people across the state, and helping them be involved in what we see as an optimal approach to prevention and treatment. And that's in place, and we expect to increase the enrollment in this in the upcoming year.
The other things, Russ, I would also add to things that we have on our list for 2022. Norm has talked about the nursing students, which we are more than excited to kind of have with us to kind of expose them to the great care that our nurses do provide at the Henry Ford Health System, but also hopefully to get them excited about their future of staying with us and with this partnership, so that they are part of our healthcare teams of the future. With that also said, as Norm has mentioned earlier, part of our relationship is also making sure that we are able to have more medical students have their clinical experience and clinical training on our sites. So in this coming year, in 2022, the first group of Michigan State University students will be coming and starting rotations at Henry Ford Hospital campus, as well as we'll be increasing the presence of students on other campuses that we have in other hospitals that we have. For cancer, what we are very excited about, as we mentioned, great work has been done so far, people together. But collectively in the next 2 to 3 months, our team and our collective team, because there is no our team and their team, our collective teams are going to be going out to recruit our future director of our cancer enterprise. We have now a service line leader. We have great leaders in clinical oncology, as well as researchers at Henry Ford Health System. We have great researchers at MSU. What we need to do is have a leader who is going to pull all of these efforts together on the research front and innovation front, put them together into that and guide us through that journey, be that driver of the train as we are going through that journey to NCI cancer designation. So this is going to be an extremely important recruitment for us, but we are also excited about those prospects because we believe what we've put together will be exciting to great emerging leaders in cancer around the nation. On another front related to things for 2022, part of our partnership was to make sure that we have a physical home for our researchers, combined researchers, that they will be able to sit together and collaborate and work on many of the great projects that we are looking at. And we identified the need to have that home, that building on the Detroit campus, our Henry Ford Health System Detroit campus. And we've already started the dialogue and discussion regarding what does that building look like? What kind of research is going to house? We have made decisions and determination what type of research. Is it wet lab research versus dry research? We have made decisions and determination what are some of the general topics that we are going to bring our teams together about. We've started to think based on the experience that MSU has had in other markets. What does that kind of design look like? What does it mean? What is the size of that entity? So the people are really deep into that work with respect to what needs to be done. And the last thing that I'm going to ask Dr. Bosham to talk to is some of the mechanism of funding for that building that we are thinking of.
As we think about how do we advance these imperatives and yet do it in a maximally cost-effective way so that we can invest money in students and faculty and recruitment, is that we unlock the mechanism in Grand Rapids in creating our innovation park, where by really putting together the story on what we're doing and what's possible, it then facilitates others outside of our organizations to want to invest and make it possible. And there's a mechanism, Russ, called a public-private partnership that we used in Grand Rapids, that when we described innovation and what Michigan State was committed to doing, we were able to get developers to fund the building for Michigan State at no cost. And then that also led to some of our community supporters to bring philanthropic support. And as we look at this mission of health equity in addressing disparities in cancer and the strengths we've brought together, we're absolutely convinced that there will be developers that will want to develop this building for us without the need for additional capital from Michigan State or Henry Ford. And we also believe that this will inspire those that have means and want to participate to contribute their dollars to the effort, because it is such a meaningful one. So we see this is a big part of what we'll plan and bring forward together. And as Adnan and I and Wright and Sam were looking at bringing this together, it was this sense that the visible strengths of what's possible together would allow those in the community to be part of something really important. And so we're super excited about that. And if I may, Russ, just add this concept of the strengths of the organizations together being inspirational to community supporters. I might mention the Hickman Munger family as an example. And this is this wonderful family that supported veterinary medicine. And when we met with them and talked about this vision, it was one of the really important things that inspired them to say, we want to make a $6 million gift that will facilitate clinical trials in the veterinary school that would then connect to human health and then connect through this translation and bringing better care to the people of Michigan. So the point I want to make is that this is not only enabling for the faculty, students, and staff within both of our organizations, but also to those in the state, in the community, that are also really committed to supporting efforts that make a difference. And we've been very enthusiastic about, as we're now messaging to our communities, because we've come up with a path to do shared fundraising, the enthusiasm that we're seeing, and again, what that will allow for synergy and new opportunities.
Well, this is MSU Today. We've been talking about the innovative partnership between Henry Ford Health System and Michigan State University with Dr. Norman J. Beauchamp Jr., MSU Executive Vice President for Health Sciences, and Adnan Munkara, MD, Executive Vice President and Chief Clinical Officer for Henry Ford Health System. Much more about what we've talked about you can find at henryford.msu.edu. And just let me ask each of you gentlemen for your final thoughts as we close. What would you like our listeners to have to really take away from our conversation today?
First, for all of those that have helped make this possible by believing in why it matters, just a huge thank you. To all of those that have been moving the shovel to help it be realized, again, thank you. And just the clarity of our welcoming, that we see this as an all hands on deck. And this is about how we bring all people together that want to help in this effort. And we want the message to be one of inclusion. This is an opportunity for all. We need the help. We welcome it. And this Helen Keller quote, right? Alone I can do so little, together we can do so much. This is truly emblematic of that. Together we can do so much. So reach out to us. We are excited for your joining in this effort, and thankful for you, Russ, in sharing the message.
First, I want to echo what Dr. Beauchamp has said. It is much gratitude and appreciation for the hundreds of people who have made this possible in the past year. As we have mentioned, the accomplishments have been beyond what I have expected, and we expected a lot. I mean, we put a lot of things on the plate of our teams to make it happen. So there are not enough words to express our gratitude to them for making that happen. Second, it is one of the things when you get into these relationships and into these partnerships, people tell you, well, it's great, now you are in the negotiation phase, or you've signed and now this is where the problems get started. And I want to say that I'm not naive or don't want to simplify that. There are not always problems and hurdles to jump. But honestly, I'm more excited today than I was excited a year ago when we were going through these discussions. Because what we have thought we are able to accomplish, what we are uncovering at the present time, is the sky is really the limit. I'm a true believer that this partnership of bringing Henry Ford and MSU together is transformational, not only for our state, but nationally. I really think that we will be making history in healthcare, bringing our thoughts, our values together and what we want to make a difference on. And these are things that are both related to innovation, discovery in medicine, education, training. We talked about DEIJ, but really transforming healthcare in the United States that it is affordable, as well as providing the best outcomes and equitable. And I think this is what drives every one of us every day, to make sure that we work together on this partnership to drive that. This is not only to just add funding dollars or to add a few students or add tuitions for students. This is not the goal of this partnership. These are important for us to achieve our goal. And as I told you, I'm more excited today and I'm more optimistic today that we are on our way to achieve that goal.
Well, gentlemen, thank you so much for your work on this important project and for updating me on it today.
Thank you,
Thank you.
Russ.
Thank you, Russ. Thank you for having us.
Again, a
Yeah.
lot more about what Doctors Beauchamp and Munkara have talked about, henryford.msu.edu. And I'm Russ White. This is MSU Today.